Welcome to our viewers. Welcome, Professor Surani.
Thank you very much. Glad to be here back again.
For our viewers, now you have seen Professor Surani with us for last few months, talking exclusively about COVID-19. Professor Surani is a clinician professor at Texas A&M, and he's a practitioner for pulmonary critical care medicine. And it's always a privilege to have you, Professor Surani. Last time we talked to you, there were many things in terms of different treatments and what has been done so far. And then some interesting data has come out. We would like to talk to you today about the blood groups. There's some interesting preprint publication has come out talking about it. So what's your own take in brief, if there is something in there or which blood group is beneficial? We know that the blood group O is protective, and people who have blood group A, they might be more suffering with it. So any intake on that, Professor Rani?
You know, one of the things is observational study. I would suggest my take is not to put too much emphasis on thinking you have an O group and you'll be doing good, and you go out without practicing physical distancing, not wearing the face covering, not washing the hand. It doesn't work. Means we have seen the studies in the past that if you have this blood group, the mosquito bites you more. This blood group, the mosquito doesn't bite. When I go outside in the mosquito season in the backyard in the evening, they bite me. Doesn't matter what blood group people have it. So I think it doesn't matter. Maybe, observational thing is maybe, they see some incidents, but again, we don't know that what the breakdown of that study really is, how many people were having some chronic conditions, what was the age group. But this is a very observational study, and I don't. My take on for folks is don't get carried away with that observational study and just feel that you have this blood group, you are going to be immune. There's nothing you can do about changing your blood group. Either you have it or you don't have it. It doesn't matter. You still have to follow the same thing. And if you're going out in an area, as I mentioned, if there is a party going on, there is a lot of mosquito, boy, they come in and bite every blood group.
That is so true. And especially one of the problems might be with the study would be that you have to look at the prevalence of particular blood group. In certain South Asian countries, you might have O and B as a most prevalent combination. So if a lot of people get infected, they'll be from those blood group as well. So I think we have to wait for further data. Now, as continuing discussion, the first, second wave, and probably third wave, those discussions are still alive. Some might say that we are still in the first wave, but second peak is going on, or a second wave is here, or we're going to have a very big or worse second wave around October when the flu season starts. So what's your take on these waves, and what can we do to protect ourselves as a non-medical personnel who doesn't understand, or at least not that familiar with the epidemiological part of it?
So if you're a non-medical person, everyone goes to the beach. You're standing in front of the ocean and you see multiple small waves coming in, a little bit medium size and a large wave coming. So there may be a lot of little ripple, and then all of a sudden a very big wave comes in, and then there are a lot of small waves. So this all depends on, in medical term, how you define the wave. If you define the wave as a global wave, that terminology would be very different. If you define based on the country, would be different. If you define based on the state, or you define based on the county. So in other words, if you look at it as a global thing, we may be still in the first wave, because if you look at it, it started from the China, and then we saw it in the Korea, the Italy, and then it came to US, and then in between we saw in Iran. Now we are seeing that it's going out in the Africa and Asia and the Central Asia, and then we are still having some surges again. And even so, that means that it is a continuation of a one big wave where you have seen the number actually going up. So the wave is like it keep on going up, and then once it comes down and become flat, then you have another one. You call it a next wave. If you look at the global numbers, and global number really never went down. So, it just changes the country and country. Sometimes this country is very high, and then all of a sudden you saw Brazil, they had a big increase in the number. And then you start seeing in India and Pakistan, and now you're seeing some of the surges back again in the China and even in the US. Now you take a step back and look at the US. So if you take the wave as coming in the Northeast corridor with New York and New Jersey, and then you feel like, oh my God, that's a very high. And at that time, you saw little blips and increase. And then what happened is New York and everyone go in and then come down flat. Whereas in the other state, you had a little small blip and then it kind of fades out. And then now we are seeing a much more bigger increase. So a lot of the folks, if you look in that area from the term where you had an increase and then come down, even though it was a little blip, the and then all of a sudden it stays there, and then you see a big surge. So the question is, are we still in a continuation of first wave, or are you in the second wave? Now, some folks in some counties and area, they had a little blip, they come down, and then they had clusters. So there was a lot of outbreak in the nursing home or the prison or some halfway houses, and you see the blips. They say, oh, that's the second wave, but those were isolated clusters, and then came down, and then this wave come in. So I think, in this country, what you define is, if you look at a global as a whole US, we maybe still can be defined as a first wave. But on the other hand, because just like initially it was in China and Italy and it come in, now it was in initially it was a northeast corridor. Now you're seeing in the whole southern states like Louisiana and Texas, and then if you go into the West Coast, you're seeing all the California side, and if you go in the South, again you see in the Florida. So you see those states coming in. So it can be a just like continuation of the wave. But if you look at, we saw a little blip and then we came down. Now we're having a surge. So that would be a second wave. And my suggestion to the community and public is not to get carried away whether we're in the second wave or third wave. When you are having an increased number of the patients who are getting infected and they're getting admitted in the hospital and they're admitting in the ICU, that is the real concern, not the numbers. Numbers are just the numbers. You classify globally, you classify by the state, you classify by the country. Doesn't matter whether you label it as second wave or third wave. But one of the thing is that leads to a question: when we had a blip and it came down, what we did wrong that we are seeing the increase in the thing. So now, that raises us several questions. So when we went into a lockdown, the studies have shown that lockdown global prevented almost 500 million infections globally. So that was a big save. Then what happened? Did we came out of the lockdown too soon? Answer is, the ideal way to come out of the lockdown, it may not be practical, is when you develop the herd immunity. Herd immunity means that 70% of your population have been infected or vaccinated and develop the antibody. We know that there is no vaccination here. So we know that the herd immunity didn't develop. Even Sweden tried to go with a process of getting a herd immunity that they said, we are not going to do social distancing. We are not going to do, life is as normal. They saw increase in the number of deaths. And they thought like, well, all the population will get infected. They try to protect their seniors in the meantime, and we will have a lot of patients or a lot of the public who will develop immunity, but their numbers were only 5 to 6%. So they even failed to achieve the herd immunity. So now the question really is that, was the timing right? And ideal timing, as I said, that you should do it when you have a protection there on 70% of the population. That means you're not going to go into sometime first quarter of next year. But how can the country manage the economy and health? Because that's going to cause an economical breakdown. So then they would design the stages, phase 1, phase 2, phase 3, and they have to go down. And again, if you look at the CDC guidelines, the guidelines are very clear. Even when you're coming out of the lockdown, physical distancing has to be done. The studies have shown that that works very, very good. Again, we know that we are a social animal. All the time, it's very tough to measure, even though there is an app, people get into your territory, whether you like it or not. It's not 6 feet. Then you have a facial cloth covering. And the protection is very important. If you have a facial cloth covering, it protects other people from getting infection from you. But if that person also wearing, they can also protect you from giving the infection. So it only works if everyone is doing that. Then we have the hand washing and the sanitizing the surfaces. Now we have another challenge. We have a lot of sanitizer, which are having some chemicals which can be potential toxic. So I think that's another challenge. But going into when we went into the out of the lockdown, the question was, did we went out of the lockdown too soon? Or when we came out of the lockdown, did we follow it? And if you look at the answer, you don't have to go too far. Your beaches were crowded, your bars were crowded, nobody was practicing really a safe distancing. Wearing the mask was very much, you know, uh, it's hit and go. And some people will wear the mask, somebody would not. And then you start seeing increasing the cases. Then again, the advices were coming out was very controversial. Some states were saying, well, we'll put the mandatory mask. Some counties were saying yes. Some counties were saying no. So there is a lot of controversy goes around that area. And again, the traveling and the restrictions were not as rigid as in India. So, for example, if you're in India, you know that India is was a complete lockdown state. You cannot even go out. You cannot travel. There is no flights going or coming out of the India except for some evacuations flight going on, and they also have a very, very strict regulation. So I think those are one of the key factors playing to it. Some folks say that we did the increase in testing, so we are picking up more. That is the reason for increase in the number of the cases, but that is not very true. We have seen tremendous amount of increase in the hospital and ICU admissions.
Oh, absolutely, I think. And then the key message for our viewers is that blood group wise, you can't change that. You still have to take precaution. And what suggesting is in terms of wave, doesn't matter which wave it is. I think basic principles of hand washing, mask, utilizing mask, and social distancing is going to be key for these weeks, these months, and probably the rest of the year. That is a way to make sure that you protect yourself, your loved ones, your family members, and then people you care about. I think we'll come back, Professor Surani, with you. We want to hear about the vaccine development in our next video when we get a chance. Thank you so much for being with us today. And for our viewers, please do subscribe to our channel, like it, write in the comment section what you want us to record next time. And we'll hope to have Professor Surani back very soon with us. Thank you.
Thank you very much.